Did you know that over 25% of adults worldwide are walking around with a silent disease that's slowly destroying their liver, and most don't even know it? You might be one of them. Fatty liver disease, medically known as hepatic steatosis, is lurking in the shadows, building up dangerous fat deposits in your liver while you go about your daily life completely unaware. But here's the alarming part. This isn't just about your liver. This condition is secretly sabotaging your entire body, from stubborn belly fat that won't budge to skyrocketing blood pressure and diabetes risk. In the next few minutes, I'm going to reveal 8 warning signs that your liver might be crying out for help. And more importantly, the hidden culprits in your kitchen that are feeding this silent threat every single day. This video, we will delve into a silent threat. 8 signs that could indicate fatty liver disease. This is a concerning condition where too much fat builds up in your liver. If left unchecked, it can lead to inflammation and enlargement of the liver, sparking a whole range of health problems, including increased belly fat. What's more, fatty liver disease can be linked to high blood pressure, diabetes, kidney issues, or an inflamed gallbladder. Before diving into the signs your body might be giving you, please subscribe to the Health Action channel today for clear, actionable health insights that empower you to live a healthier, happier life. Hit the notification bell so you never miss out on vital health knowledge. We're dedicated to bringing you reliable, easy to understand information and practical tips to help you live your healthiest life. Let's start. Over time, this can lead to progressive liver damage, where scar tissue, called fibrosis, starts to form. This scarred tissue actually prevents your liver cells from properly cleaning your bloodstream, leading to a buildup of toxins throughout your body. Alarmingly, over 25% of adults worldwide are grappling with fatty liver disease, largely due to their diet. One major culprit is the excessive consumption of omega-6 vegetable oils like margarine, cottonseed oil, corn oil, soybean oil, or canola oil. These oils inflame your liver cells, hindering the normal fat digestion process. Additionally, eating too many sugary foods can worsen the problem, as these sugars are converted into free fatty acids that clog up your liver. Alcohol consumption is another significant risk, as it activates specific genes that tell your liver to store fat instead of burning it for energy. Furthermore, high fructose corn syrup, found in over 80% of packaged foods, especially in things like soda, condiments, and fast food, quickly turns into fat in your liver, adding to the problem. In rarer cases, certain medications, drugs, and viral infections can also damage the liver, leading to fat accumulation. It's important to note that fatty liver disease often goes unnoticed on standard liver enzyme blood tests, meaning it can persist for years without detection until severe damage becomes evident. To help you tackle this crucial health issue, today's video will outline the top 8 signs of fatty liver disease. This will empower you to recognize and take action against this silent threat. Important disclaimer. Please remember, this video is for educational purposes only. If you have any medical conditions or concerns, it's always best to speak to your doctor. The 8 signs of fatty liver disease. Let's look at the signs your body might be giving you. Right shoulder pain. The first sign of a fatty liver that deserves your attention is pain in your right shoulder. If you experience discomfort or tension in your right shoulder, neck, jaw, or under your shoulder blade, it could be connected to a fatty liver. Your liver plays a vital role in producing bile, a liquid essential for digesting and breaking down fats from your diet, like meats or olive oil. However, when your liver becomes overloaded with too much fat, this bile thickens and gets stuck in tiny ducts. This causes the liver to swell and become inflamed. This swelling puts pressure on the phrenic nerve, which runs along your right side, and can result in pain that you feel in your upper right back muscles or your neck. Abdominal fat, pot belly. The second and most common sign is having a lot of fat around your belly. If you have a protruding pot belly appearance or a noticeable accumulation of fat around your midsection, it's very likely linked to a fatty liver. This happens because fat starts to build up inside your liver, and once it runs out of space, it expands outward, forming both visceral fat around your organs and subcutaneous fat under your skin in your abdominal area. Visceral fat, in particular, poses significant health risks because it surrounds your internal organs, hindering their normal function and potentially raising blood pressure, which increases the risk of heart attacks. It's crucial to understand that a potbelly shape isn't the only indicator. Visceral fat can be present around your organs, even if you don't outwardly appear to have a large belly. Spider veins. Liver damage often leads to elevated estrogen levels. This occurs because a struggling liver has difficulty processing excess hormones, throwing your body's hormonal balance out of whack. High estrogen weakens your body's veins, leading to the development of small spider veins on the surface of your skin. These veins typically have a central red spot with reddish extensions radiating outwards, resembling a spiderweb. Male breast tissue development, gynecomastia. Returning to sign number 4, men with fatty livers may experience an accumulation of estrogen as mentioned earlier. This hormonal imbalance can lead to the development of female-like breast tissue in men, a condition called gynecomastia. Initially, this often appears as a lump of fatty tissue just beneath the nipple, and it can sometimes be tender to the touch. Swollen right foot. If you notice that your right foot and ankle are significantly more swollen than your left, this could be a common indicator of liver damage. When you press your finger into the swollen area on your foot, it might leave an indentation, a condition known as pitting edema due to fluid buildup. This swelling is attributed to compromised blood circulation resulting from liver dysfunction. Itching of the hands or feet. As we've previously discussed, a fatty liver can lead to blockages and leakage of bile. This causes bile to accumulate under the skin. This buildup of bile triggers the release of histamine in your blood, resulting in intense itching sensations, particularly on the soles of your feet or the palms of your hands. Low thyroid function. It's worth noting that hypothyroidism, or an underactive thyroid, is often a consequence of liver damage. Your thyroid gland produces a hormone called T4. About 80% of this T4 is converted into its active form, T3, within the liver. However, a fatty liver or cirrhosis can impede this crucial conversion process, leading to sluggish thyroid function and broader metabolic issues. Constant fatigue or lethargy. Feeling persistently tired or lacking energy is a very common outcome of a fatty liver. While fatigue can be caused by various factors, a fatty liver is one of the primary and most prevalent contributors to persistent weariness. When excessive fat accumulates in the liver and insufficient bile is released, your body struggles to absorb essential fat-soluble nutrients from your diet, including vitamins A, E, D, and K, as well as carotenoids from plant sources. This leads to reduced levels of antioxidants in your system, leaving you feeling perpetually fatigued, weak, and sluggish. If you find yourself experiencing a cluster of these symptoms, it's highly advisable to consult with a healthcare professional and request an ultrasound examination. An ultrasound is a non-invasive procedure, commonly used even for expectant mothers, that uses sound waves to create images of your liver and its intricate network of blood vessels. This diagnostic test can clearly reveal the presence of any accumulating fatty deposits within the organ. Reversing fatty liver disease. 6 lifestyle changes. Thankfully, the liver possesses a remarkable ability to heal and regenerate itself. To address fatty liver disease, let's explore 6 lifestyle modifications that can facilitate the removal of excess fat from your liver, promoting its natural recovery and healing process. Eliminate inflammatory vegetable oils. Cut out inflammatory vegetable oils such as margarine, soy oil, corn oil, cottonseed oil, canola oil, and processed olive oils from your diet. These oils are frequently used in fast food and packaged foods. Instead, opt for cooking your own nutritious meals at home, incorporating healthier alternatives like organic raw coconut oil, extra virgin olive oil, and cold-pressed avocado oil. These healthier fats are enriched with essential nutrients like vitamin E, which actually helps in dissolving scar tissue within the liver. Consider digestive enzyme supplements. Think about incorporating a high-quality digestive enzyme supplement into your daily routine. Take it on an empty stomach about 1 hour before each meal. Make sure it contains purified bile, pancreatin, and betaine hydrochloride. These enzymes help thin the bile in your liver, enabling it to dissolve excess fat and cleanse the organ. Additionally, a daily dose of 300 milligrams of CDP choline is recommended, as it plays a crucial role in enhancing the quality of your bile, which is the detergent responsible for breaking down fat and eliminating it from your liver. Drastically reduce your consumption of sugary, starchy, and grain-based foods, such as sweets, bread, pastries, pasta, rice, and potatoes. Replace these items with anti-inflammatory foods like wild-caught fish, grass-fed meats, and pastured eggs. These protein sources are also rich in choline and leucine, essential nutrients that actively aid in fat removal from the liver. Also, make sure to incorporate organic sulfur-rich vegetables such as garlic, asparagus, onions, and leeks, as well as cruciferous vegetables like Brussels sprouts, radishes, cauliflower, and broccoli into your diet. The sulfur from these foods enhances the enzymes in your liver responsible for fat breakdown and detoxification. Support liver detoxification with 150 milligrams of milk thistle extract taken 2 to 3 times daily. This herb contains silymarin, a powerful compound that boosts the production of glutathione, which is considered the master antioxidant produced by the liver. Glutathione promotes the healing and regeneration of liver cells while regulating inflammation throughout the body. Allow your liver adequate time to dissolve existing fat by refraining from frequent snacking and constant eating throughout the day. Consider practicing intermittent fasting, where you consume all your daily calories within a 4-hour window, followed by a 20-hour fasting period. This fasting approach triggers autophagy, a natural process where the liver recycles old scar tissue and damaged proteins, essentially transforming them into new functional components in cells, aiding in regeneration. Start your day with a liver cleansing tonic. To aid in the reversal of fatty liver disease, stabilize your blood sugar levels, and enhance nutrient absorption, start your day with a simple yet potent tonic. Mix 1 tablespoon of apple cider vinegar and 2 tablespoons of raw lemon juice diluted in 500 milliliters of water, and consume this on an empty stomach each morning. This concoction is rich in acetic acid, citric acid, and vitamin C, which work together to cleanse the liver, reduce fat accumulation, and promote increased bile production. It serves as a simple yet powerful daily tonic for those dealing with fatty liver or digestive issues. To learn more about this crucial topic, please like this video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy.